The FCPR is a criterion reference test and is not standardized. Scores are based solely on the clinician's judgment and clinical experience. Therefore, results will vary from clinician to clinician. Due to the non-standardized style of the FCPR, there is no set location or administration time and no age referenced or severity norms. Purpose. The purpose of the Functional Communication Profile Revised, or FCPR, is to assess individuals with developmental or acquired delays on 11 major communication skills and related aspects including sensory motor, attentiveness, receptive language, expressive language, pragmatic or social language, speech, voice, oral, fluency, and non-oral communication. The FCPR can be used with clients ages 3 years to adult, chronological age, or with a mental age as low as 1 to 2 months. The purpose of the FCPR can be found on page 4 in the examiner's manual. The FCPR is adaptable to a wide range of disordered clients, ranging but not limited to autism, aphasia, mental retardation, Fragile X, behavior difficulties, cerebral palsy, schizophrenia, TBIs, and sensory impairments. Examiner's Manual. The manual includes purpose, overview, suggested use, administration time, scoring, test item selection, prompting levels, and materials. It also includes how to score the test items in greater detail. Manipulatives. Here's a list of possible materials listed in the examiner's manual. It's up to the clinician to pick appropriate materials for the client. Some of the items may include activities of daily living, such as magazines, hygiene products, money, a writing tablet, noisemakers, clothes, images of common objects, storybooks, etc. For certain populations, the clinician may also utilize alternative communication systems. This is a close-up of the FCPR form booklet. It is 12 pages in length and includes a section where the clinician records the client's personal information. This is also where the clinician scores the assessment items. For each of the 11 skill categories, there are numerous specific skill areas assessed. The results of the FCPR will give the clinician a picture of the client's current language skills for each subtest rating from normal, mild, moderate, severe to profound. Due to the criterion reference style of this test, the results the clinician might expect to encounter is the client's level of speech and language. For sensory motor, it assesses hearing, vision, self-help skills, gross motor and fine motor skills, and behavior. Attentiveness. It assesses attention span, alertness of others and environmental events, response levels, and cooperation of the client. Receptive language. This assesses verbal and nonverbal comprehension, comprehension of basic concepts, pictures, objects, ability to follow routine and environmental commands, object identification, and two-dimensional recognition. Expressive language. This assesses verbal and nonverbal communication, methods of communication, verbal, self-expression, object interaction, cause and effect, grammar, vocabulary, and mean length of utterance. Pragmatic or social language. This covers communicative intent, questioning skills, conversational skills, turn-taking, topic initiation, maintenance, elaboration, appropriateness of communication, reading, literacy, writing, spelling, and memory. Speech. This assesses intelligibility, sound production, omitted or error phonemes, dentition, articulation, and oral motor imitation. Voice. This covers loudness, vocal quality, and pitch. Oral. This assesses mouth breathing, drooling, tongue thrust, swallowing, and diet. Fluency. This covers fluency, rate of speech, rhythm, and intonation. Non-oral communication. This assesses the use of sign language, two-dimensional expressions, current alternative system and effectiveness, and fine motor abilities. In addition, the Functional Communication Profile Revised form has an explicit writing area titled Summary for the evaluator to fill in, such as the test results, current communication objectives, communication strengths, communication weaknesses, needs, general interventions, strategies, related plans and other settings, residential and day programs, recommendations, progress, referral, etc. How to administer the test. Complete the top portion of the first page of the record form with the client's information, such as their name, date of administration, birth date, age, and where the assessment was held. Next, check off the proper box. Is it a re-evaluation or initial evaluation? Also, what method of administration did you use? Direct assessment, informal observation, review of records, or informant interview. Next, include any important factors in client's relevant history. This test requires the clinician to do a lot of prepping before the test is given. Clinician will start at subscale 1, known as the sensory motor, and fill in the appropriate boxes that apply to the client. This is to be continued throughout the rest of the subscales. The last subscale, which is non-oral communication, can be skipped if the client is verbal. The examiner is to rate the client's performance for each evaluation item, even if the skill is scored as none, non-applicable, or unable. The clinician must provide age-appropriate stimulus materials and environmental items which are familiar to the individual to be evaluated. This is an example task of understanding basic concepts in the FCPR booklet. The clinician rates the client's behaviors by checking one of the following items: functional, limitations, or poor. For functional, the client has to comprehend at least moderate awareness of each of the 16 categories, or complete comprehension of at least 12 of the categories, 75%, if 7 years or older. For limitations, the client must comprehend between 4 and 11, 25% to 69% of the categories listed, certainly aware of some concepts with deficits for others, if 7 years of age or older. For poor, the client must comprehend less than 25% of the categories, 3 or fewer, if 7 years of age or older. How to score the FCPR. The FCPR is an informal instrument, therefore there is no scoring. Subjective decisions are based on the responses to the test items and the clinician's general impressions. You are directed to rate the client on various parameters, including severity of impairment, frequency of occurrence, mode of communication, degree of independence versus assistance of prompting, quality of performance, and inventory of skills, depending on the individual test item. Case history. Anne is a 26-year-old female who was diagnosed with Down syndrome at birth. She has spent the majority of her life in a residential home. It is difficult to fully and adequately assess Anne's comprehension due to her level of cognition interfering with completion of clinician-generated tasks. Two of Anne's favorite activities include playing dress-up and drawing. Currently, Anne's expressive language continues to be delayed. When asked about herself, she needs to be prompted to retrieve a response. Anne is very shy and has difficulty sharing personal information. Her gross motor skills appear to be fully functional. She is able to answer yes/no questions appropriately and attempts to answer WH questions, such as who, what, and where, by echoing the final word of the question. Anne's parents fear that her lack of expression will inhibit her ability to live a social lifestyle. Her family is willing to be an active part of her speech therapy process.
Hi, Anne. So I heard you like magazines, so we're going to take a look at some pictures in magazines today, okay? Okay. Anne, I want you to follow my pencil from the red lipstick to the pink lipstick, okay? Anne, ready? Anne, take the pencil from my hand. Okay, good.
From this portion of the session, the clinician can assess the sensory motor subscale. It gives the clinician insight on her auditory localization skills, eye contact, and grasp.
Anne, we're going to do a fun activity with the iPad now, okay? You ready?
Yes.
We're going to read a passage. Okay. It's called Little Miss Mary and the Big Monster Makeover. Anne, you ready to pay attention? Because I'm going to ask you some questions. Okay. Little Miss Mary was tired of shopping. All day on her feet. Anne, please sit down. We're going to listen to the passage, okay?
Mm-hmm.
Little Miss Mary was tired of shopping. All day on her feet she'd been merrily hopping, from boutique to salon, from one to the other, while asking for this and that from her mother. What was Little Miss Mary tired of?
Tired. I don't know.
Okay. Do you know who she went shopping with?
Her mother.
From this portion of the session, the clinician can assess her attentiveness. It gives the clinician insight on her attention span and her response rate.
Anne, you ready? I'm going to give you this wallet. Give me $5 from the wallet.
Four, five.
From this portion of the session, the clinician can assess receptive language. It gives the clinician insight on how she gives objects to the speaker and her ability to understand basic concepts.
And we're going to do another exercise on the iPad. Okay?
Okay.
I want you to look into the camera and smile. What makes you smile?
Smile. When I go shopping.
I want you to look into the camera and make a sad face. What makes you sad?
Sad. When I fall off my bike.
From this portion of the session, the clinician can assess expressive language. It gives the clinician insight on her verbal status and expressive level.
And so I heard you like jelly sandwiches.
I do like jelly sandwiches. I don't like them with peanut butter, but I really like jelly sandwiches.
Okay, so I brought you a jar of jelly, a knife, and bread. Can you show me what to do with these items? Good.
From this portion of the session, the clinician can assess expressive language. It shows the clinician her appropriateness of object use.
And so I'm going to ask you a couple questions. You ready?
Yes.
Okay. Who drove you here?
Here.
Who drove you here?
My mom.
What did you have for dinner?
Dinner. Spaghetti.
What is your favorite food?
Jelly.
When do you brush your teeth?
Morning and night.
Do you like to draw?
I like to draw a lot.
Okay, so now I have some markers, and you're going to just draw me something.
From this portion of the session, the clinician can assess pragmatic and social. It shows the clinician her ability to answer who, what, and where questions, when, why, and how questions, and answer yes or no questions.